Hi students, by now we have given you some lectures about the basic anatomy about the external and internal genital organs. In our lecture number 3 there were ovaries, and then lecture number 4 it was uterus, then 5 it was fallopian tubes, and then 6 it was vagina, and the 7th it was external genital organs or the vulva, and then the clinical correlates about all these organs. This was our second phase, and in the third phase now it is the practice of the MCQs. What MCQs usually, what questions, clinical scenario based questions they come in the exams. These exams is not just the exams for the undergraduates but also for the postgraduates. In FCPS part 1 and the PLAB, or you say USMLE step 1 and other AMC and other type of examinations, these questions in fact they are repeatedly asked. So we have formed here 30 to 40 such questions, and we have made here a slideshow of these questions, some of their explanations also, and as far as their explanations are concerned, and their key also will be discussed during these slideshows. We have 40 to 50 such questions. We will scroll these questions and we will tell you something about them. This will give you a kind of a practice. It's a third phase of studies in our anatomy is this, and fourth phase, when another slideshow will be actually presented, that is the case presentation. You have to see regarding your internal and external genital organs. In case of female, we will put certain, or we will present certain clinical cases, and these cases will be discussed, and upon that case we will actually put certain questions, and using your previous basic as well as clinical knowledge, you will try to solve these questions. You do have to answer them in few lines, and once you are good at this fourth phase, we will think that in the female genital organs you are very good at, and you will feel yourself comfortable and you are at home in these topics here. Any type of exam, it's not just undergraduate exams, but in the postgraduate exams also you will feel yourself comfortable. There is nothing extra that you have to actually aid in that course. That is from my side, at least it is enough. This is the end you can say. Whatever next you see beyond that fourth phase will be certain experiences and all these things you will observe during your passage. You can just make a notebook and you will actually put certain headings, or you see certain captions, or you can aid them over our workbooks and over our notes also. Otherwise you don't have to aid a new thing at all. You may be certain things you see you have during the certain lectures, you have some knowledge, some few words which are not included, which were not discussed previously, but basic knowledge already is confirmed with you. And now if you are actually firm in that basic knowledge, you can add a few other things also, which will be some additional knowledge about that. Nothing will be new at all. So you see these things are discussed in your fourth phase, but this is our third phase. You see this is MCQ practice, and we have formed here a slideshow again, and in that slideshow there will be 40 to 50 questions which you have to practice here. But this I want to actually give you and clarify that these questions basically they have come in the past papers, they are available here and there. We have formed them, we have classified them, we have explained them at times, and these questions, not necessarily these questions will be repeated in the exams. Make that thing clear in your mind. But the questions will be identical, the cases are almost identical, the question scenario will be different, but the questions are in the same pattern. These are actually the practice. This is the practice of the MCQs which you are doing. That does not mean that they will be repeated, or these are actually the question bank which we have leaked here, nothing like this one. These are the questions for the practice. They have appeared many times in past papers, past exams here and there. We have collected them and are giving you here a package to give you a practice that what you have done before, like the basic anatomy of that organ, those organs, then the clinical correlates. Now you want to test yourself that previously the questions which have been in fact put to the students, whether you can answer them or not, and how and which way you have to actually answer them. Another thing, before solving these questions, you see, before answering them, whenever clinical scenario is presented to you, this is your question, and the question is actually asked from what is the option, what option is correct. Don't jump to the options, don't read the options immediately. See the scenario and think over the scenario and find out the answer of that scenario from your mind, you see, bring that from your mind and then find out whether this answer is present in ABCD or not. If it is present ABCD or not, so it is present here, so it is present either at A or B or C. So that means do not find your question, you said do not find your answer from the options. Read the scenario and think about the scenario and find out the answer from your mind, not from the options here. Options is just to see whether your answer is present there at which position it is present there. This is just for that, not for finding out the answer from that. Now, if you find out the answers from that, you see all the 5 answers, all the 5 options you will actually look correct. But if you are knowing about that, even if you half the scenario you have studied, if your knowledge is good, basic knowledge good, clinical scenario you have, clinical correlations you are good at, you see that half the scenario you have discussed, if you have discussed half the scenario, the answer will flash in your mind immediately. You just to confirm whether that answer is present at what position, at what option, at what position A, B, C, D, E, at which position your answer which has flashed in your mind without looking at the options, it is present there, and then you mark the position that C is the option. C is my answer and this is my answer and this answer is actually located at C. So, C you will darken. This is something is the answer. Do not find your answer directly from the options. Answer should flash in your mind almost at the half of the scenario, usually it is actually usually it is solved here, or 3/4 of scenario you have completed, you will see that, or sometimes at the end of the scenario still the answer is not clear, then you will think upon, and then if you are not clear yet, then you will go to the options here and we will actually discuss how these options in fact will be taken here. When the answer is not clear, even after the scenario has been discussed, still the answer is not clear. Still the thing is not clear. Thing is not clear means either the scenario is difficult or your knowledge is not perfect. Means you are not good at the basic knowledge of that organ and you haven't actually discussed the clinical correlates of that organ. If these 2 phases you haven't discussed previously in a better way, the 3rd phase will be difficult for you and surely the 4th phase will be almost impossible for you. So, you should actually be doing this here, and when you will enter the 4th phase, it will be much easier, it will be almost identical to the phase 3, but this is the case here, and in the case the patient will come to you. This 4th phase we will discuss in the next lecture and we will tell you how this will be actually solved here. And when you have discussed the 4th phase from our side, you have discussed the female genital organ, do not add even a single word after that, even after you have passed your final year, everything you see that, but you see all these things, basic, clinicals, MCQs, and the 4th phase will be the clinical cases, and surely this will be discussed more and more will be added when you will actually discuss pathology in 3rd year and 4th year. And when we enter into the final year, you see these cases will come here, like you see vagico-vaginal fistula, this will come in the gynecology again. There is a big topic in the vagico-vaginal fistula, but you see already you know about the vagico-vaginal fistula, you know about the uterus, their positions, everything you have studied in the anatomy. And these things you will correlate, you will actually add them, and you say a big case will be prepared for you and you will be knowing everything about that. When you will aid in final year in gynecology and obstetrics, you will aid in the gynecology vagico-vaginal fistula. You will aid the prolapse here, you see that the prolapse of the uterus, you see uterine prolapse, already you know that what is uterus, where it is located, what is pelvis, all these organs, pelvic floor, everything you know. Why, what is pelvic uterine prolapse, why it is happening, means before entering into the subject of gynecology, you know the basic things and it will be much easier for you to understand beyond that now. Now you see risk factors, you see the examination, what is the things are here, what are the remedies, or you see treatments here, what clinical procedures, what surgical procedures, what their complications, you can now add after when you enter into the final year. The things will be actually much easier, but you see here these 4 phases you should complete here in anatomy. So, we have actually discussed and prepared here a slideshow of the MCQs related to the female genital organs, and there are 30 to 40, probably 45 MCQs here, and we will scroll them and you will be actually watching here. Some of the questions have been explained also, but almost all of the questions, their key has been discussed there. So, let us watch the slideshow related to MCQs about the genital organs, female genital organs here. Let us watch the slideshow.